Let's talk about muscle relaxants. It's a term we hear all the time, right? Maybe you've even been prescribed one. But what if I told you that simple phrase is, well, it's actually pretty misleading? Today, we're going to pull back the curtain and demystify what's really going on when you take one. So seriously, think about it. If your doctor hands you a prescription for a muscle relaxant, what do you imagine is happening in your body? You probably picture it going straight to that tight, sore muscle and just telling it to chill out, right? Well, the real story is so much more fascinating and, frankly, way more important than you might think.
Okay, let's start with the official textbook definition. A skeletal muscle relaxant is basically any drug that messes with muscle function to decrease the tone, which helps with things like spasms and pain. It's a super broad catch-all term. And while that sounds simple enough, the devil is really in the details.
Because here's the kicker. That one single term, muscle relaxant, is actually an umbrella for two fundamentally different types of medication. I mean, they work in completely different ways. It's kind of like calling both a bicycle and a rocket a vehicle. Yeah, they'll both move you, but how they do it is what really, really matters. And here is the great divide. On one side, you've got your neuromuscular blockers. These guys are what we call peripherally acting. Think of them as working on the outskirts, right there at the muscle itself. Then on the other side, you have spasmolytics. These are centrally acting, which means they go for the command center, your central nervous system, so your brain and your spinal cord. Let's dig into each of these. All right, first step, neuromuscular blockers. The easiest way to wrap your head around these is to imagine they work right at the finish line. Your brain can shout the command, contract, but these drugs step in and block that message just before it actually reaches the muscle. And here's what's so crucial about them. They interfere with the signal right at the neuromuscular end plate. That's just the fancy term for the tiny junction where the nerve ending meets the muscle fiber. And this means they have absolutely no activity in your central nervous system. They don't make you sleepy, they don't affect your brain at all. They are laser focused on that one specific job. Okay, now for the second crew, the spasmolytics. So if the blockers work at the finish line, this group, they go straight to the top. They work at the control center. Spasmolytics. These are the centrally acting muscle relaxants. And you know what? These are the ones people are almost always talking about. They're what you get prescribed for a stiff neck, a pulled back muscle, that kind of thing. They work by basically telling the main control room, your brain, to just calm everything down, which then tells your spasming muscles to take a break. So, we've laid out the two very different teams. One acts on the muscle, the other acts on the brain. So, when your buddy says they're taking a muscle relaxant for their back pain, which one do you think they're really talking about? And there you have it. According to our source from Dr. Uoraka Christian, even though there are two totally separate groups, the term muscle relaxant is almost always used to talk about spasmolytics and only spasmolytics. Those neuromuscular blockers, they're super specialized drugs you'd pretty much only run into in a hospital, probably during surgery. Let's just lock this in because it's the main takeaway. The next time you hear someone say muscle relaxant, you'll know what's actually happening. It's not targeting the muscle directly. Nope. It's acting on the central nervous system, kind of like a depressant, dialing down the frantic signals from the brain that are causing the muscle to go haywire. And that, right there, is a massive distinction. So the big question you can now answer is this. Is the medicine working at the finish line, or is it working at the control center? The next time you come across a muscle relaxant, you'll know it's almost certainly working on the brain. And just knowing that one thing changes everything. It explains the side effects, like why they can make you drowsy, and why it's so important not to mix them with other depressants. Now you're in the know.